Hi everyone, welcome to another Lead Squared webinar. I hope all of you are safe and well. I am Kartika from Lead Squared's marketing team and I will be your host for the day. We all know that for the past few years, telemedicine has seen an immense boom, but we have so much more to understand, so much more to navigate through. So today we will be discussing about the innovations in telemedicine and how we can adapt to the era. So let me quickly introduce our experts for the day, our speakers for the day. We have Mr. Sonal Gupta, who is the Vice President of Business Development here at MediBuddy. So Sonal, thank you so much for joining us today. We're really looking forward to learning from you. So please tell us a bit about you and what you will be discussing on this webinar.
Yeah, thanks, Kritika, for onboarding me over here, and thanks, Vineet, for joining us and as well. So I am Sonal. I had the business development at MediBuddy. I've been working with MediBuddy over the last 5 years now, and prior to this, I've worked for edtech companies like Adroit, Tutorvista, and Byju's, and for 7.5 years. And prior to that, I had expertise in working with the insurance companies and internet service providers. So I think overall, I feel that I'm pretty lucky to be working in the sectors which have boomed significantly over the last decade or so. And today we will go through a few of the things which we have done, interesting innovations over the last 5 to 6 years at MediVedi and DocSap, and how we are planning to take this forward as well with you guys.
All right. Thank you so much, Sonal. Really looking forward to listening to your learnings from MediBuddy and your career so far. Thank you so much for joining us again. We also have Mr. Vineet Tiwari. Vineet is the Assistant Vice President here at Lead Square, and I'm sure you are very familiar with Vineet's face if you're a recent viewer of our Lead Square webinars. But for the people who are new here, Vineet, please tell us a bit about yourselves and your journey so far.
Thanks a lot, Kartika. Hello, everyone. So my name is Vineet, and I'm with Lead Squad from last 7 years. Lucky to work and explore and learn in software, in fintech, in telecom. I mean, these are the three industries where I have been working in last 16, 17 years of my career, and all these 16, 17 years, I mean, like purely in sales and business development. And so it's an honor to share stage with Sonal here. Thanks a lot, Sonal, for joining the session. We will be making this session. We'll try to make this session very enthusiastic and very much a kind of a learning session for the audience.
Of course. Thank you
Yes,
so
thanks.
much, Vineet. Thank you, Sonal, as well. So, before we actually get to the webinar and the discussion for today, I have a few pointers for the audience as well. So, as you can see, you have a couple of options towards the right side corner of your screen. There is the chat option where you can interact with us, our speakers as well. There is the questions tab. So, if you have any questions throughout the webinar, please do put it up over there. Our speakers will take them up towards the end of the session. So be a little patient, but of course, please do put up your questions there. And we also have a couple of polls that we'll be publishing. So please do respond to that. We would absolutely love to hear from you. And for a better viewer experience, please do put your screen on full screen. And if you are facing any troubles, there's a help button towards your left side corner. Follow the steps there, and you should be good to go. With that, I think that is time's up for me. So I'm going to quickly pop to the back end, and I would love to hand the session over to Vineet. Please take it forward.
Thanks a lot, Kartika. Again,
Thanks.
let's start. So we are going to discuss about telemedicine. So telemedicine itself is a very interesting subject, segment, and industry. So we should take the context from the COVID era. So it's like during and post COVID, the it's like world has seen a transformation in healthcare. I mean, how healthcare has been it has been operating, and telemedicine has emerged with a very strong wave, and the intent here is to provide the timely access of healthcare to the remotest of the people. I'll also just read a fact which tells that the worldwide like market for telehealth is estimated to be worth $83.5 billion, and it is anticipated to expand at a CAGR of 24% in the next 7 years, which means that there is a huge and massive opportunity here. And this industry is going to like completely okay transform how healthcare is seen and perceived by people. So to start with, so Sonal, I would request you if you could like give us an overview about this industry.
Yeah, thanks, Vineet. So I just want to give you a few of the glimpses, right? That uh, we started talking about telemedicines, especially post-pandemic, right? But I think the work started much more prior to pandemic. It is just that the pandemic has given the tailwinds in the favor of telemedicines. That's the reason it has grown at the pace which it was not even expected to be growing. So I started working in this industry for Docs at Meribody, I think around 2015 kind of a stuff, which is there. And the thought process is that was that why is even telemedicines needed, right? What was a need? Is this something which can become a big thing in coming future while the technologies companies were coming into existence and the things were working? So I think one of the important factors which was there was which we have seen is that doctor to population ratio, if you talk about in India, I'm talking about the specialist doctor, MBBS doctors, that is currently trending towards one doctor to 1400 people across India, whereas WHO recommends one doctor to a ratio of 1000 population. So if you see that, then definitely there is a shortage of specialist doctors in India. And if you come back and think from the perspective of tier 1 cities, tier 2 cities, and tier 3 cities, this is even gets really bad in tier 2 and tier 3 cities, right? Because majority of the good doctors come and stay in the tier 1 cities, so that ratio is pretty much skewed in the tier 2 and tier 3 level. So that's the reason I think telemedicine definitely is one of the stuff which has started seeing that kind of attraction which it wanted to be there. And also I think from the perspective of the convenience for the customers, for the convenience for the patients, if they have to travel, right? Just imagine if you are staying in one of the cities nearby Bangalore, maybe a Mysore, or maybe 200 300 kilometers. If you have to take a consultation from somebody in Bangalore, you will have to travel 200 300 kilometers, right? Now instead of doing that, all what you can do is that get on the conversation with the doctors online and have a consultation with them. You can say take second opinions from multiple doctors for that particular matter, right? So I think uh, definitely the ratio from doctor to population is low, and that's the reason the need of the industry and the technology will play a very very major role in the coming years of ahead.
Yes, I completely, I mean, like aligned. I'm aligned on that. That yes, I mean, technology is going to be like play a very kind of crucial role in making it possible. Now, with these lines, Sonal, a thought has come. That we are seeing everything in two segments basically. Okay, one is it's like okay. The world how it was operating say before 2020, I mean COVID, and after COVID. In So in terms of adoption of telemedicine, it's like, do you also think that it was, it's like, was it just a wave, or you see that there is a steady change that is happening in this industry, or it's like how organizations, how the patients are kind of like seeing it.
Yeah, I think that's a very valid question, right? Because at times we always think from a perspective of, is this something which is sustainable for a long period of time, or is this something which has just come in because the pandemic came and there was a need of the hour to get towards the telemedicines, right? That's a very very valid question. I'll just go back to the initial phase when I started working at MediBuddy, right? So when we started doing this teleconsultations for the users, online consultations for the users specifically to call, we used to have only chat and phone call as one of the facilities which we can give to the customers. Uh, and that particular time, it was very tough even to convince a user to take a consultation with the doctor over the call, because customer was not sure how will this work, will this doctors really help you across with the consultations or diagnose your problem or give you any kind of a prescription. So what we figured out is that the initial feedback which came from the customers was that they wanted at least to see the doctors, right? They wanted video consultation. This came in early 2016's kind of a stuff, right? And they wanted to talk to the doctors in the same language. They wanted to connect to the doctors at a faster pace. So I think in the initial few years prior to pandemic, though this was a new concept, we understood what was the requirement of the users. We enabled and worked upon giving that kind of a platform for the users so that they can utilize or can take online consultations or use telemedicines, right? So I'll just give you a scenario that in 2016 kind of a stuff, if a user comes to our platform, hardly he will take, if he is subscribed for a consultation, is taking an online consultation, he will end up taking only 1.5 consultations in a year. And that was a worrying factor, right? Very worrying factor, because customers are not using the platform, customers are not using this category as often as ideally it should happen, right? A person ideally in a year may require approximately 3 to 4 consultations. And if there is a family of spouse and kids and you have your parents, then ideally the family will end up taking around 12 to 15 consultations throughout the year. This is what the standard protocol is. And when we saw that the number of consultations are significantly low, we worked upon what we can do for the customer to make sure that they stick to our platform. So we came up with one of the programs of MediBuddy Gold, where the customers can take unlimited consultations for their family members. So even prior to pandemic, we have got a hook of the customers where the customers were using our platform to take consultations for them and the family members for at least 8 to 10 times in a year, right? And when we hit the pandemic in 2019 and early 2020 kind of a stuff, we saw the pace at which the customers came for obvious reasons on the platform to take consultation increased from a 8 to 10 towards a 16 to 18, right? That showed that people who are coming on the platform, they will continuously use it across, because it was continuous reasons of pandemic which is there. But what has happened even post pandemic, I would not say that the pandemic is still over, but still now what we are seeing, the trend is that people are almost taking 12 to 14 consultations, which is much more higher than the number of consultations which were happening prior to pandemic. So definitely I think people have got an understanding of how this will help. Definitely technology has played a major role in the sense that now you can take video consultations. Previously in 2015-16, you didn't had that kind of a great internet services as well, right, where you can have that kind of a video consultations with the customers. So now you can take video consultations with the customers. Now customers are a lot more patients, a lot more familiar that this is something which can work around. So I think though pandemic gave us that particular uh, uh, upside in the trend of consultations, but now the trend is continuing, which is a great factor. And one of the interesting points I would say is that our renewal rates have increased towards 2x kind of a stuff as compared to what it was, and it is maintaining at the same levels even though the COVID has come down significantly as it was in 2021 and 22. And now I'll just give you one more important interesting factor is that now people are taking our subscriptions and are enrolling for this service for even 2 years to 5 years plans as well. So 50% of our renewals at this point in time, first of all, our renewals increased to 2x. Now 50% of our renewals are trending towards a bigger package, that is your 2 years to 5 years renewals. And interestingly, and we have few of the customers who have even taken enrollments for 25 years from us, right, for telemedicines and online consultation, which shows that people understand it, people are using it across, And though technology and pandemic has got the tailwinds in our favor, but that kind of a growth will be sustained, and it will be something which will be used by the prospects.
Interesting, Sunil. So, like after this, in continuation to this, since we are talking about the challenges that we face while implementing this as a solution. So one is, as an organization, you are scaling up, right? Earlier, if your volume was X, now it has gone to 2X. Earlier, if your subscription was say A, okay, now it has become 3A. So with this scale, if you're scaling up, what are the kind of major challenges, okay, that you have faced and tackled? And look, part B of this question would be, we also discussed about the customer's expectation, right? That earlier customers were kind of shy to come on a video, or to take a subscription for yearly or 2 yearly. I mean, those kind of things. But now the expectations from the customers has also changed. And how are you able to manage those expectations? So two folds. Okay, one is from your end as an organization, and second is the behavioral aspect from the customer side. So if you could
Yeah,
help
so
us understand that as well.
yeah, thanks a lot. So I think one of the things, the challenges which we faced, I think I'll just give you one of the rough numbers, stating that 50% of our consultations come from a tier 2, tier 3, and tier 4 cities, right? And even though the internet has really been phenomenal and we have got great broadband speeds, still at times customers face challenge in regards to the connectivity. If the call drops, then it becomes a lot more difficult, right, that to connect with the same doctor and take the consultation again. So I think internet, though it has come very far, but still there are a lot of ways to go forward, and it has been one of the challenges which is there. Other challenge has been, I think, when a user comes to a platform to take a consultation, or may take this as one of the second opinions, right, for taking a telemedicines. So what happens is that you may not have the entire documents of the history of the total issue what the customer is facing. You can just go ahead and explain it to the doctor. You can send your prescriptions to the doctor. You can send your lab reports to the doctor, but not the entire adequate patient records are in front of the doctor, and which can be challenging because you do not have end-to-end history to look into from the perspective of the patient. So I think these are a couple of things which we are facing now. Because of those particular factors, what we have even done is that if you come and take a derma consultation, we ask you to upload your issue or images well in advance. If you are looking forward for any kind of a checkup, we'll ask you to upload your health records, so that the doctor has the complete visibility of the past track records what has happened, and can diagnose and can treat you and take it forward on the basis of that. So I think these are a couple of things which has been challenging. Other challenge which we face, the third challenge has been a lot of customers, when they are looking forward for consultation, want to talk to the customers in the regional language, right? You may not be that great in English if you're calling from a tier 3 and a tier 4 city, kind of a stuff, right? So I think a language barrier was also a problem, but we have overcome that. We are currently providing more than 10 languages on our app, where the customers can talk to the patients in the language they are preferring. If you want a consultation in Kannada, we'll provide you in Telugu, Tamil, Marathi, and so on and so forth. So I think these were few of the major challenges. Few of them are already sorted out, but I think a bandwidth issue in a tier 3 city, I will still say at times it happens, call drops and all that happen, and that becomes a bit challenging. But over a period of time, I think we will go overboard on that as well. I think on the other point of your question was, I think, how are users' expectations changing? I think uh, if you see and think from a perspective of any industry, right, the user expectation will keep on rising. Okay, it's a graph which will keep on going on the upward side. And if you talk about the product, right, your product will always be flattish, right? Because when you got into this particular product, you will just first think that you will provide a solution to your user. But when you provide a user solution to the user, the curve at which the expectations keep on going up will be significantly high, and that is something which we have to make sure that we manage that across. I'll just give you a few of the examples before I get into how we are doing it across for telemedicines, right? If you talk about maybe 10 years back or 12 years back, if you have to travel, if you have to go to airport, what you will do is that you will go to a driver and you will say, "Ki, boss, you come tomorrow at 6 o'clock in the morning and drive me to airport." And you will call up again at night, remind him, "Ki, boss, please come, otherwise my flight will get delayed." Now what you do is that you call him in the morning also, and you again try to remind him. Now what happens is that today you can just have a click, get a Uber or a Ola right away in next 5 minutes of time. But now what your thought process is changed is that now you want very good, clean cab. What you want is that a very disciplined driver. So I think user expectations similarly in our industry, I think in 2017, 18, you provide a consultation. First of all, as I told you, right, the expectation was, how will this work? And when you understood, okay, this will definitely work, uh, customers wanted us to have video consultations. They wanted us to have the doctors available in a matter of minutes. Even if a doctor comes to connect with you in 15 to 20 minutes of time, it is, people think that it's very much delayed. Why don't you get it just a click away? Then you talk about getting the doctors in your same regional language. You want to talk to the doctors who are certified, who have immense experience, right? You want to talk to doctor who only has a 15 to 20 years experience, whereas the same job can be done by a doctor who's 10 years of experience and who's expertise. So I think customers expectations are rising, and we as a category, as an industry, we have to keep ensuring that we provide and get into giving that kind of a solution to the users.
True, true. No, like the expectation will always like keep on increasing, and this increase in expectation also drive the organizations to improvise, to improve, innovate, and like give a better experience.
Yes.
Okay. So coming back again, Sonal, to since a lot of the audience are also from similar kind of industry segment, and it is going to be very important and helpful for them as well. So I would just want to understand, okay, if you have to effectuate the virtual healthcare experience for the patients, if you could help us understand that what sort of this technology like would be needed. So what is the kind of IT slack that would be needed, or the technology? I mean, different kinds of technology basically required to create this solution, which kind of like gives a seamless experience to the customer. I mean, patients.
Yeah, I think technology has to play a major role, right? I think with the help of technology, you can send digital prescriptions to the users, which is much more better than carrying your physical prescriptions, right? You can keep that at any point in time along with you. Along with that, a lot of people, what they prefer is that uh, reminding people that, okay, this is the time where you can check your blood pressure, this is the time when you can refill your medicines, this is the time when you can go ahead and take a preventive health checkup, right? So I think a lot of communication with the users is something is gonna be very important, and technology will definitely play a role, because technology will make the communication between the patient and the provided a lot more seamless and a lot more clear. And that is what the customers and the patients also expect us to be doing, right? That they get the medical alerts, they get that clinical flags, so that at least you'd reduce the chances of having any kind of issues later part of time. So I think those are few of the things which are definitely needed as a solution in healthcare, that we provide, use technology to communicate with the users effectively, and basically give them that breather, that you do not have to, everything is not going to happen all of a sudden. It is, You can have a lot of stuffs which are preventive. You can get to know about your health well in advance, and we keep reminding them in a much more better and a personalized way.
No, I mean, this is super helpful. So Sonal, also I was just like reading an article about Medibuddy, and a few pointers I wanted to understand that since you guys are now serving in tier 2, tier 3 cities, and this is increasing basically the internet density across India, in all the places. I mean, across over is increasing. If you see, even the remotest of the villages have also now covered with internet. So is it helping you as well, in terms of your reach? And second, uh, so earlier it was just the consultation that was done only for say, I mean, general medicine, general physician, but now it is okay turning out to be into specialties as well, and those specialties can be even say, I mean, types of, like, okay, it's like cardiology, or it may be okay pediatrics, these kind of specialties as well. So what's your say on this? I mean, like, how it is increasing, and like what is the trend look like, if you could help us understand from that
Yes, I
perspective.
think, yeah, definitely. As I mentioned earlier, also the trend has been that around 53 to 54% of our consultations basically are from tier three, tier two, and tier four population, and that trend continues to be significantly high. One of the things which we have also seen is that even if the people who are staying in tier one city, right,
Mhm.
and they have their parents staying in a tier 2 and tier 3 city, they take the consultations for them as well from our platform. So it is not the matter that if you are not staying with your parents, you they cannot take a consultation. They can definitely take it. So I think that is one of the very great advantages for them, that you can utilize the services even when you are in tier 2 cities, and you can take it for your parents in tier 2, tier 3, and tier 3 cities as well. Also, I think a lot of convenience and a lot of expenses are being reduced for the users while they are taking consultations from a tier 2, tier 3 city, right? You do not have to travel a lot. You can just go ahead and get on the conversations. Even suppose that you have to do a surgery, you do not have to go ahead and come to Bangalore first to take a consultation and then go back home, prepare yourself, and come back and take a surgery over here. You can have a online video consultations with the doctor, and get yourself prepared for that and directly come for the surgery. So I think a lot of users are coming to the platform from a tier 2, tier 3 cities for their second opinions, also for a lot of different departments, as you mentioned, right? So I think when we started off, we had general medicines and three to four more departments, that is derma and your pediatrics and gynec, which were few of the primary consultations where the customers needed help. But right now we have 26 departments in which the customers can take consultations, and all these are departments which are readily really available for you to take consultation 24 bar 7. So I think this is something which has really worked in our favor, and that's the reason, if you see, right, when I spoke about 2015 and 16, a person coming to a platform who took a consultation was taking around 1.5 consultation. When they enrolled for our subscription, they started taking 7 to 8 to 10 consultations. Now the reason behind that is definitely technology, that is your internet going deeper into rural cities, into tier 2, tier 3, and tier 4 cities. Also, we did a lot of additions in regards to what we understood the customers needed, right? If you have a parents, then they may look forward for consultations in regards to what they need help with. If you have kid, you need pediatrics. If you have spouse, if she's female, then you read a gynec, right? And that's how the things have progressed significantly. Additions of departments has definitely helped. And also I think with the virtue of uh, the cost of the healthcare getting reduced for a tier 2, tier 3 city people is something which has helped us significantly. Ideally, if you think about as a company, I will talk at this point in time about Medibuddy. We want to make high care healthcare accessible to all, right? High quality healthcare accessible to a billion people, and that is only going to happen when this is cost effective. Even the people who are there can do not have to even think. I'll just give you one of the examples, right? One of the people came to our platform, I think this is early 2017, and when we were doing a lot of survey with the users, and they took a consultation, and we saw that this guy, this person is not using consultation. So we saw in D0 that a person has not taken in a consultation. He's just taken one consultation, and we wanted to take a feedback from the user. Okay, ki, why are you not using your service? And when we asked that particular user, and this is, I'm talking about tier 2 and 3, tier 3 city users, not about on tier 1. This guy says, oh, I was thinking and assuming that at that particular cost where I can get unlimited consultation, I'm just getting one consultation. And that's the reason he just took that one consultation and didn't proceed. So I think being very cost effective is one of the very important factors, and definitely that is something which will ensure that the people who are willing, who are early bidders, will come to the platform and test the platform to see how this will definitely come. And over a period of time, you will have more population with the word of mouth getting spread, that this works, will definitely come back. I'll just give you one of the examples of myself. When I started working at Medibuddy, my mom was very very worried, right, that how can you take a consultation. Now even she is at her hometown, she directly goes ahead, clicks on the app, consults with the doctor, and takes care of the thing. So I think that is something which is happening now, and it will continue to happen as more awareness kicks in, and as more and people try to use the services.
The thumbs up and the smileys that came, on the screen, it shows that yes, our audience are also aligned on this. Exactly. One question which pops up, Sonal, is basically, I mean, all the telemedicine is on a virtual setup, right? So two aspects of it. Okay, one is the customers, I mean the patient information basically, and there is like a lot of like data flow. So it's like to and fro of data and information is there in the virtual system. So how do you ensure to manage the security and the privacy of the data of all your patients who are involved into this system?
Yeah, I think all the records which are there in our systems are only accessible directly to the users on their app. There is no access of any kind of a digital records at a company level to anyone. Once the doctor prescribes the medicines, it is only been referred or can be downloaded only by the customer. Even one of the things which is very important, if you log out right from the app, first it will ask for your OTP, just to make sure that it is not that somebody else can on behalf of you go ahead and download the stuffs, right? It is also very important for us to understand why is privacy even needed. And that is what we used to think, I think a few years back, that suppose that you are doing a consultation, if somebody has prescribed for a consultation, he wants to have a consultation, at times it can get very awkward. Suppose that you are planned for a consultation and all of a sudden you are not in a space to take that consultation, right? Then the privacy becomes a lot of a challenge for the user. So what we have even done on our app is that if the customers are unable to take the consultations because of privacy issue, they can reschedule their appointments at a later stage with that particular doctor, so that you are ensuring that that doesn't take it taken away. And also when there are any kind of other stuffs which we happen, like if you have to do a lab test for that particular matter, if you're taking a consultation and suppose that you have to undergo a lab test, we go ahead and first confirm with the patient that where do you want the lab test to be done, right? Is it at your home, or you want to go outside and take care of those particular stuff? So I think from the privacy perspective, yes, it is a must. On the security front, we have enabled and we have ensured that the customers records are being accessed only by the customers themselves, not even anybody from the company. So I think those security concerns are being taken across, so that customers can peacefully take care of the stuffs and not to be worried about anything which can happen.
Super helpful. Uh, So Sonal, we started with kind of a few lines on the future of healthcare. Now, in that perspective, if you have to see that what role is going to TM play in the future of healthcare, I mean, what would be your thoughts on that?
Yeah, so I think we have come, first of all, we have come a very long way. I think even I'll just give you one of the examples. My wife had to go undergo one of the surgeries. I went to one of the hospitals, and I didn't knew that the doctor will be who was available at that particular day. Next day, he told me we can do a video consultations and can schedule the surgery as per your convenience. So I think. Uh, Video consultations and telemedicines definitely is gonna play a very major role. To start off with, it is gonna be it has been a game changer for a lot of people in tier 2 tier 3 cities, because it reduces the cost of healthcare. You do not have to spend that much time. For the people in tier 1 cities, it is more of a convenience, right? You do not, now people in tier 1 cities do not want to walk out of their house for any particular reasons, right? So I think from the comfort of their home, they can get access to a great healthcare service. Apart from that, I think telemedicine can help in preventing health issues, right? Health diseases, which can be prevented. You do not have to have the just keep waiting for endless days to get to know that you have some kind of a issue. It is just that if you get any kind of a issue, you can just directly talk to a doctor any point in time, which was never something which we imagined in like 15 years or 20 years back, right? Unless it used to come to the neck, people didn't like to use to go to the doctors. Now it's just a one click away, right? Now you can talk to the doctors and you can get to know how the issue is, and you can early detect the issues which are rising. So I think that is something which is gonna be a primary thing which will help us. Also, I think from the perspective of a lot of uh, video conferencing, teleconferencing, doctors even trying to go ahead and talk to different doctors about a issue which is there, right? Can be stuff which can be leveraged across by the doctors as well, right? Because you do not have to have or take care of the entire stuffs on your own. You can just collaborate and work along with other doctors as well. And similarly for the patients, now if you are tending to go with a particular doctor, you do not have to basically look forward for going ahead with the same doctor. You can take second opinions with multiple doctors. Suppose that you are sitting in Bangalore right now and you have been prescribed for a particular diagnosis. You can have a conversation with the doctor in Bombay, you can have a conversation with doctor in Delhi, you can have a conversation with doctor in Chennai. So I think these are few of the things which is definitely an upper edge in regards to the telemedicines, and it will definitely go a long way. And I think the kind of tailwinds which got into our favor from pandemic are showing that consistent tailwinds in our favor, and I think the industry is a lot to go in future as well.
True, true. So Sonal, one, as I mentioned earlier as well, that a lot of our audience are from the similar kind of industry and segment, and would want to learn from the session, kind of best practices which we have kind of implemented or you have implemented in terms of your organization, where if you have to integrate okay, like telemedicine and healthcare together. So if you could share some of the best practices that will help the audience and us
Yeah,
as
I think one of the things which has worked out significantly for us has been we have been very customer centric.
well.
I think that is something which can be a takeaway for a lot of people, and even this is a takeaway for me as well, right? Pick and evaluate patient-centric stuffs which you can do. And when you do that, then automatically you look towards giving the solutions which the people are looking forward for. Few of the examples which I gave you in our case was getting into video consultations at a faster pace when nobody even expected it to be there, right? We knew that it was challenging, but we kept on thinking that okay, if the user needs it, we will give it to them. People spoke that they wanted to talk to doctors in regional language, we provided them. They wanted to reschedule the appointments with the same doctors. We knew it was so challenging. You cannot have one doctor who can be a click away every single time when you want to have a consultation, but we enable. So I think we need to work upon enabling features which are completely customer and patient centric. And once you get that to that particular step, ideally you will make a lot of things much more better. Other thing is that I think you have to create and build and think from a perspective of an entire ecosystem. What Medibuddy has done significantly well over the last few years of time is that I think we started with an online consultation. And if you talk about when we saw that there are 10 people, one person who's taking 10 consultations for himself and his entire family members, what we even saw was that if you are taking 10 consultations, you will be prescribed with 5 times medicines, you will be prescribed with 2 times lab test, right? So you have to ensure that you provide the medicine service as well at a faster tag, at a faster discounted price to the customers. Similarly, when a customer has been prescribed lab test, you need to make sure that the flabo goes to the customers out next day or the very day, and ensure you provide him, if there is a radiology network test which is prescribed, you provide him the network. So I think enabling and looking into the things that what customer wants is something which you can give in the same platform and build your business over and above that is something which is gonna go ahead and add a lot of value. The only thing which we didn't had I think till 1 year back was surgery. Now we, when we understood that customers are even looking forward for surgeries to be facilitated and they want us to be the end-to-end platform, we have now started enabling end-to-end facilitation of the surgeries as well. So I think keeping customer in mind is the most important stuff. Second thing which I would say is that track your KPIs. It's very important to track your KPIs. And the reason behind it is that if you do not know what is the satisfaction CSAT of the customer, then fundamentally it makes a lot more difficult that what you are trying to go ahead and give to the users. Second is, one is your customer centric, that is your CSAT. Second, I think, is more of how many people are delivering the services right to the user. Because why it is important is that at times, because right now we are very well funded company, you can have unlimited resources and you can help x number of people, but at the end of the day what will happen is that it will increase the expense of healthcare, which is something which is not affordable in a very long run. If you want to disrupt the market, you can do that, but ideally that's not the solution which you are looking forward for. So I think keeping those things in mind, and one is customer centric and keeping customers happy, checking the CSAT scores, and having the right team to provide that particular output of satisfaction and care for the customer is something which I think people should look towards doing.
This discussion has been like very interesting, and like there are still like a lot of things are there to discuss, but I have to keep a check of time as well. So in the interest of time, I would take like one last question, Sonal. So you would have seen basically that so okay. So I'll take the permission from Kartika as well. If we can take one more question, Kartika.
Sure, definitely. Yes, yes.
Okay, great. So Sonal, if you see, so government's focus on this telemedicine and the whole like virtual healthcare concept is increasing a lot, and in the budget also like a lot of focus is there on that. So how do you see kind of a like public-private partnership like emerging in this virtual option?
Yeah, I think this was a very tough question if you would have asked me in 2016 and 17. Uh, we were always thinking, okay, will be any kind of a setback uh, from the government? But I think we got a great insights from the government that they want private companies to come forward and take care of this and collaborate with the government in enabling a high healthcare care infrastructure. So I think that is how developed companies, even countries, even work. That they work along with private companies, private and government work together and take care of the things. And I think we have got a great support from the government over the last 2 to 3 years of time in enabling and giving the go ahead for all the right ways. And definitely, whatever are the checks and balances which are also coming as a part to be done, are, I think, are mandatory to be done. So I think hats off for the government to enable what they have enabled for so far, and definitely great signs that they are coming up with checks and balances as well, because that is something which is needed, right? You cannot have everything running on their own and making their own rules for that particular matter. So I think we are privileged.
Thanks a lot, Sonal. So, Kartika, if we have some, like questions from the audience, we'd be happy to take that.
Of course, we actually have a couple of questions from the audience as well. We'll try to cover as many as possible. Meanwhile, to the others as well, please keep your questions coming and please do respond to the polls as well. And thank you for the amazing conversation as well, Vineet and Sonal. So, with that, let me just quickly get to our first question. The question is from Harry. They ask, what is the concern for e-pharmacy activities in terms of fulfillment and delivery after prescription is created and redeemed online by the patient?
Can you repeat that question again? I think my internet got disrupted.
Sure, definitely. I have put it up on the screen as well for the audience to see. What is the concern for the e-pharmacy activities in terms of fulfillment and the delivery after prescription is created and redeemed online by the patient?
Yeah, I think this is something which has come over the last few years of time, and one of the things which is happening is that the deliveries are definitely improving over a period of time. But I think checks and balances in regards to oh, the prescriptions which are to be submitted by the customers or the patients on the platform for all these e-commerce companies, this e-farm companies, is significantly very important. I think otherwise it can get a lot of issues in regards to what people are looking forward for ordering online, right? And it cannot be something which can just get away like that. So I think a lot of e-commerce, healthcare companies are working with the likes of ensuring that the right uh, prescriptions are being taken by the customers. If the customers do not have prescriptions, provide them a tele consultations and work upon fulfillment. I think fulfillment has been a bit of challenge, and the reasons behind that are pretty obvious, that it's not a we're not into a grocery business, right? Where you order something and all of a sudden it has similar kind of a brands. I'll just give a few of the highlights. A doctor in Bangalore, if somebody is taking a consultation in maybe in Noida, will give you a subscription, or will give you a prescription, sorry, uh, which will have a different tablet, right? Which can have a different stuffs. Now that kind of a stuff is not available over there. So what happens is that it becomes very difficult and challenging for us to go ahead and deliver that. Then in that particular time, what we do is that we ask the doctor to write one more prescription and make those changes to the medicines, and so that it can be provided to the customer. So I think it is tough. I am not saying that it is that easy, but I think as soon as we go forward, we will get the right stuffs in place in order to make sure that we go ahead and deliver the right stuffs. And delivery definitely is going to be a very very important stuff.
Of course. Thank you so much, Sonal. Vineet, if you have anything to add to it, or we can go to the next question.
No, I think we can go to the next because Sonal has covered almost everything in that.
All right, great. I hope that answers the question as well, Harry. So I will go to the next question from Sandeep. He asks, my concern is the absence of trust since we are consulting remotely. This is especially relevant for villages. Are there any significant calls from villages? Okay.
Yeah, I think uh, trust has been one of the challenges. I think, especially in when we started off teleconsultations, I think 5 or 6 years back, this was a lot more challenging, right? One of the things which has really worked in our favor has been video consultations with the doctor. I think a lot of people, when they come to the platform, when they used to have a chat consultation or a call consultation were really thinking, is that really something which they can trust or believe upon? But when they see a doctor sitting on the other side asking you questions, it is as good as taking a physical consultation with the doctor. So I think those are few of the things which has helped us to enable the trust for the users, and that's the reason what we have seen is that our repeat rates have increased significantly for the users using the platform, especially in tier 3 tier 4 cities, and there are a lot of users coming from the villages as well. I'll just give you a few of the examples on the villages side, right? Few of the people in the pharmacy took the membership from us, and if a customer comes to the pharmacy, wants to have a prescription, medicines being given to the villagers, they will take a teleconsultation on our platform, and then we'll give them the medicine. So I think these are few of the things which are even happening in villages, because the people understand that it is much more better to consult a doctor and then get the prescription. So I think those kind of stuffs are something we have seen users taking so many consultations. So when we reached out to them, we understood, right, that your family, if you have a family of 6 members, you cannot take more than like 15 to 20 consultations, but we have users on our platform who take like 200 300 consultations. So these are basically medical people who have medical stores, and when the users or the villagers or people come to the shops, they provide them the consultations, and then they take it forward. So I think trust was a factor a lot more in early 2017-18, but now with video consultation coming in, I think the things are improved a lot.
If I can add a line like on this, Kartika. So trust, yes. I mean, like as Sonal mentioned, with somebody who is visible on like, video, it means there is a human being sitting behind, and that human being is a doctor. And on top of it, if it is localized, say for example, from a village in Karnataka, if somebody is asking a question and if the doctor is answering in Kannada, it like the bonding automatically happens. They will be able to share everything with the doctor, like whatever problems they have. So yeah, I mean, like earlier, okay, this was a problem. And the reason being, the families, they used to visit, okay, one doctor. It's because there was a trust factor on that doctor. It used to be a
Yes.
family doctor basically for everything. But now, since the times had changed, the technology has evolved. This setup is also evolving. So people are having, okay, trust on the person who is seeing. It's because it is in person. So video consultation is as good as a kind of in-person consultation.
I completely agree. I would say actually, even for me, recently I had gone for an in-person checkup, and then they had recommended for me to take supplements. But then, as an Indian, in my head, I was like, okay, I had an aversion to supplements, so I actually took two more video consultations just to make sure that it's the right way to go. So I think it works both ways now, and we're all very set up with technology as well. We have another question from Nidhi. She asks how to measure patient satisfaction level and how to convince them for video consultation, as most of the people in villages are still stuck with one-on-one consultation. So I think the last question kind of answers this one as well. But as far as patient satisfaction goes, any inputs, Sonal and Vinny?
Yeah, so I think once the consultation is done, we send the survey to check the NPS scores of the consultation which has happened with the customer. That is your net promoter score. So that is how we basically check the consultation. How to convince the user for a video consultation? I think one of the things which we have done is that as a default option at this point in time in MediBuddy, we have ensured that you take a video consultation. I'll just give you an example. When we started the video consultation, I think you have asked, first of all, a great question, right? Uh, there were only 10 to 15% of the people who were willing to take a video consultation, because you also need to be present in the right frame of mind and approach to talk to a doctor on a video call, right? It's not that people can just come back and take video consultation. So I think what we have seen over the last few years is that the trend has changed towards 60 to 65% of the people going ahead and taking a video consultation on our platform. So I think that's a significant jump. And I think from the convincing perspective, I would say that we are not trying to convince the users if they are worried about having the call itself, we are still fine with that, because I think we let's not introduce indulge and get into their privacy as well, right? If they just want to have a call with the doctor as well, it's completely fine. It is just a matter that if you think that okay, you don't trust the person, or if you really want to have a conversation with the doctor over a video call, you can go ahead and do that. I'll just give you one of the examples of myself, right? I think over the last like 5 to 6 years, I would have taken like 15 to 20 consultations for myself on the platform, and myself have even taken only 3 to 4 video consultations. More of, apart from them, it was more of on call consultation. So I think we have to think from the privacy of the customers as well perspective, that at times I don't want to get on the video consultation with the doctor, because I know what questions I will ask I may get the answers on the call itself as well, right? You do not want to see the doctors at times when you who are really in a different phase of mind for that particular matter. So I think we will not try to convince, and we don't convince the users to only go ahead with the video thing. It is just a matter that we will facilitate what is best for the user and let user choose the medium of having the conversation with us.
That's actually a very nice way of going about it. Vineet, if you have something to add to it.
No, I think no. I mean, Sonal has very beautifully covered it. So,
Yes, I agree. I agree with that. All right, so I hope that answers the question, Nidhi. So a lot of questions have come about the technology aspect of it, actually, Sonal. So there's a question by Sagar. He's asking, were there any technology challenges during your scale phase? So if you would like to elaborate on that.
Yeah, I think during the pandemic, it was a lot of concern, right? I think we got 3 to 4x consultations at a very, very faster pace. And at that particular time, the video consultation was also something which was new for us as well, right? Because you were not, first of all, you're not planning for that particular skill, which you might have got maybe 3 years or 4 years down the lane. And I think working to give the best video solution to the users on our platform was one of the challenges which we faced. And I think our tech team did phenomenally well in a matter of like few days of time to come up with that solution that didn't impact the users under any circumstance. So I think giving the video consultation platform was one of the challenges which we definitely faced during the scale phase.
All right. Vineet, would you like to add something to it, especially when it comes to technology and the amount of traffic that comes in?
yes, I mean, see, so technology is definitely an kind of enabler, and with right technology, it helps organizations if they have deployed the right technology to scale up. It's because you can handle a scale with certain technology. Say from 0 to 100, there is a technology available, or even your like whatever the basic systems that you have, it will be able to satisfy, or it will be able to satiate the requirement. But when your scale, say, I mean, grows up from 100 to a 10,000 or a lakh or to 10 lakh, or then like millions, then you need a different kind of a technology that should be auto scalable, and it should be able to support you basically. So while adopting the technology, like an organization should be like very cautious that what sort of technology they are adopting. Is it auto scalable or not? Is it open to integrate with other systems or not? Those are some of the things that we should like cognitively look into.
Of course, completely agree with that, and I think our audience does too. Vineet, there's a special question for you, but it is an off-topic question. So Kunal is asking how to start out in SaaS sales. So I would suggest Kunal, you take that up with Vineet.
We will pick it
You can
separately,
email us.
Kunal. Yeah.
Yes, definitely. You can email us as well. We can take that up. So let me just quickly take up another question since we're reaching the end of our time limit. So there is a question from Manisha. She asks, "What is the correct time duration between the appointment and the connection?" So I think the connection is like establishing a connection, if I'm not wrong.
Yeah, so I think as soon as we get the request, ideally 80 percentile of our connections with the doctor happen within 10 minutes of time. So I think that's a number which we are looking forward, and that's what I said, right? The users' expectations are significantly going on a direction that they want a one-click uh, uh, call from the doctor as soon as they request for it. But at this particular time, within 10 minutes, or 80% of our consultations are happening. We even have closed few consultations in a matter of 15 to 20 seconds as well, because the doctor is available at that particular time and he goes ahead and takes care of that. But 80 percentile in 10%, 10 minutes is the right number at this point in time for us.
That's great statistics, I should say. Uh, Vineet, anything to add to that,
No,
or
no, this is an aspirational like a number, I mean, Sonal, which most of the organization would want to reach there probably. And you guys are doing fantastic actually. If it is okay within 10 minutes, it's really aspirational number. Great.
yes,
We
of course.
want to do campaigns where we can say that get a doctor in 5 minutes, but first of all we have to reduce that towards a 5 minutes of 90 percentile, then we can basically work upon enabling that.
Sure, sure. Perfect. I think like going forward, it may be some matter of time. It's a matter of time basically. But yeah, I mean that phase is also going to be soon.
Of course. All right, I can see that there are so many more questions. Unfortunately, we have kind of reached the end of the session. Our time limit has been reached, but please do reach out to us with more questions that you might have. We'd love to take them up, and we will have more sessions from Leap Squared as well, so you can join them as well. But before I end the session, I would thank both of our speakers here for this wonderful, insightful session that we've just had, and the audience as well. You were wonderful, very engaging, so really happy to see that as well. And I hope that everyone has a lot of takeaways, just like me, because I have several. So before that, before I end the session, Sonal, we need any closing remarks for our audience?
I think getting questions is the right way to look forward for uh, for this course, right? For the webinar. If a lot of people are asking questions, that's always great, right? That people want to get more of the steps. I think it would be great that you can shoot out those questions to me, and if we can give the answers to the users, and that can be sent across by any modes for that particular matter, it would be something great for me.
Definitely. We will definitely do that, Sonal. To the audience as well. So you just listen to what Sonal has said. So if you have any more questions, please do put it up on the tab. We can definitely send them across. So we need any closing remarks from you as well.
Yeah. So I'll try to summarize as per my understanding in two lines our discussion basically. So, like Sonar, so as per my understanding, basically, okay, telehealth, like telehealth development, and as an ideology, it reflects on kind of like making and or it so it reflect on okay making the long distance okay medical care safe, effective, efficient, and patient centered like health management environment. I mean like that's what I could summarize. And everyone is intended to reach here. Every organization which is there in this setup is trying to reach at this stage. And it's like that's what like I have understood from today's discussion. And like thanks a lot, Sonal, for all this like insightful and interesting like discussion.
Yeah.
Of
Thanks a
course.
lot, Vineet and
Yeah, and
Karthik.
thanks a lot, Kartika, for having us here.
Thank you so much to both the speakers again. And yes, to the audience as well, we will share the recording with you after the webinar. So I can see that someone had joined really late. It's no worries, Kunal. Please, we can send the recording to you, and feel free to reach out to us over LinkedIn as well. All of us are available there as well. Okay, so with that, I think we have come to the end of the session. Once again, thank you so much for joining us, Sonal and Vineet, and to the audience as well. All right, so I think we've come to the end of the session. So everybody have a very wonderful rest of the day. Thank you so much.
Thank you.
Thank you.
Thanks everyone.